I'm working as a nurse for the past 25 years, and for the past 25 years, uniform allowance for nurses have been at $300 annually. And if you look at the cost of living today, $300 can only buy us our scrubs. So, but our uniform includes shoes, so the allotted amount should be enough to buy shoes. What I know from it may be raised from $300 to $500. Also, there is what we call a night allowance that is given to nurses. Then at this time, it is $50 for every 20 nights that you work, but you only get to work 7 nights per month. So to reach 20 nights, you have to work at least 3 months or so before you could get that allowance. I believe that they want to raise that allowance to $100 or something like that. Contrary to what they may give in the what the government might offer, in our CBA, I believe we are asking for that night allowance to be monthly rather than based on the amount of nights that one work. So yeah, those are a couple of the allowances that I know that the government may have in their package. May so be that they may have a raise of salary for nurses, I don't know, or a salary adjustment. But our last adjustment for nurses was in 2012 when we had that adjustment along with the nomenclature name changes throughout the nursing system. So I yet to wait to receive to see the document that the government is pledging to give as a package to nurses to retain us. The retention of Belizean nurses is long overdue, but not only Belizean nurses, but nurses that works in Belize in a whole. Because what we have seen over the years is that because of the global demand for nurses, our Belizean nurses or nurses who works in Belize are being offered packages in the US, Canada, and the UK mainly, and those packages are bonus. They have signed bonus. They find places for them to stay, and then the salary is very attractive. So the government has to match that if we are going to retain our nurses to stay in Belize.